question. Okay, the question is colonics, or seeing a colon therapy, I think they're sometimes called hydrotherapy practitioner. A lot of naturopaths will do this. It's essentially getting cleaned out. And I think it works. If you're looking to detox, a lot of my yoga practitioners will usually want to detox. It's called detox before they begin a new exercise routine or lifestyle. Detoxing the old-fashioned way is typically cleaning out the colon, cleaning out the liver, and sometimes cleaning out the blood. The easier ways to do it, obviously, the easier ways to do it are to buy a little box for 14 days, stick with the box, kind of decrease your calorie intake, and by the time you're done, you've hopefully gotten rid of a lot of bad things, but more importantly, you've reset your body to say, hey, listen, I know the taste of good food and not having bad preserves in me, and now I'm going to enjoy, from this point on, a good diet. The same thing comes with colonic. If you clean the gut out, the theory is that you get rid of a lot of the byproducts and the waste that's supposedly sitting in the colon for a long time. You'll hear about guys on TV talk about cleaning out the colon, and they'll actually show pictures of all this poop that they got rid of when they went through colonic. I don't know that it's, I should say that there are limited studies that say it changes your immune system much. But the majority of the people that I have go to get colon therapy, they feel great afterward. I think there's something, even to stem from that, my patients who have to get CT scans of their abdomen for any, for what I feel might be wrong, or for a uterus that's too big, or a pancreas we're looking for, I have to, before you get a CT scan of the abdomen, you have to clean yourself out. You have to do an enema before you go to get the test done, or before any kind of major surgery, you have to get an enema. And usually people who finish the enema will feel great because they're lighter, they're empty, they're not as bloated. So I think there has to be something that with the mechanics of getting a colonic that make you feel good. I don't think there's too much risk in a colonic except for overinflating. If you have diverticulitis, you shouldn't be doing it because irritation to the colon, if you already have it and you put this fluid in, you can actually pop one of the little diverticuli, so it's dangerous that way. For the most part, it's safe. But the thing is, when you do get cleaned out, when you do have a colonic, I like to have my patients also take a probiotic. I think probiotics are important. Those of you who don't have any probiotics on board, if you ever get an antibiotic and you're 5 days of antibiotic or make you feel great afterward, no more cough, no more bronchitis, always chase that with 30 days of any good probiotic. The majority of us don't have good bacteria in us. I'm seeing a guy, couldn't figure out with his doc, he just came to see me for the first time, young guy, and he's really with it. He's about 20-something, has a whole bunch of problems. Brain fog, multiple joint aches, feels bloated, irritable bowel, and he couldn't, with his doctor, figure out what was the trauma, because there's always a trauma that precedes the disease. Couldn't figure out what was going on. Then he mentioned he had sinus surgery. And I said, oh, so you had sinus surgery once. And he said he had sinus surgery twice. And the year before he had the first sinus surgery, he had a year of antibiotics. And that was enough trauma to cause a total change. Antibiotics are good. They kill bad bacteria, but they also kill good bacteria. Good bacteria is in the colon. You have to have good bacteria here. The biggest immune system organ is the colon, the small intestine. So if they're working okay, your immune system works great. But having a colonic and not doing anything else, you have to be careful. If you're going to have that and clean yourself out, get on a probiotic, and from that point on, maintain a really good diet. So in that sense, I think it is good, but you have to also be prepared. After you have the colonic, you got to make the changes after that. Don't just rely on that.
How frequently once a year?
For those of you who do have a colon problem or any irritable bowel syndrome, if it's approved, sure, you just have to make sure it's okay. Again, I think detoxing is wise twice a year. In the spring, in Ayurveda, you detox in the spring and you detox in the fall, when the harvest of the summertime is changed and the harvest of the wintertime is changed. There's different foods we rely on, and to get ready for the different foods, you have to have a detox, supposedly. So at least twice a year with the detox and the colonic. More than that, it kind of depends on how you feel. It also depends on how much you want to spend. I think there might be other things to spend money on. I don't know what colonics cost nowadays, but I would say at least one, and then put the rest of the money into acupuncture, registered dietitian, food creation, exercise physiologist, something like that. More than that, I question why would somebody need so many? Sure, sure. Any other questions?